To everybody who is listening to us, and we hope that you will have a very enjoyable session. And from my end, wishing all of you a very happy International Women's Day. I'm Hema Mani. I'm the vice chairperson. I'm the chairperson of IWIN Tamil Nadu, still living in my past world. Just took over the chairmanship this year for Tamil Nadu. I have been associated with CII Indian Women Network for the past 3 years now, and I've really derived amazing benefits and really proud of the way the network contributes to developing women in various streams. I just would like to take us a few seconds to establish what CII IWIN is all about. CII, as you know, stands for Confederation of Indian Industries. It's an organization that has been in existence for close to 75 years. And IWIN, which stands for Indian Women Network, is a vertical of CII and has been doing some profound work towards empowering women, enabling women in various ways over the last 5 years or so. The network has presence all across India. We have chapters and zones all across India. Wherever CII is, you will find Indian Women Network presence. Today, across the southern region, we have close to 6,000 active members who are part of Indian Women Network. And I welcome each one of you who are part of the panel here, all the wonderful women who are part of the panel, as well as all of you who are listening to us to become part of the membership community. And the reason I say that is what the network offers out. Through the network, we contribute a lot towards leadership development of women. It is a pathetic story that only 1% of women actually reach out to leadership positions in organizations. And this is one network where we try to create platforms, create avenues, create programs that help nurture women into leadership positions across business communities, across corporations. The second biggest aspect that we focus on is to drive prevention of sexual harassment at workplaces. While there is a national law in place and the country has made huge strides towards prevention of sexual harassment or workplace harassment, we still have a huge journey to traverse with. So it is with great intent that we've put together a team that focuses on driving prevention of workplace harassment, especially among small and medium scale enterprises. The third aspect that we work in Indian Women Network is to really nurture young talent across various campuses, especially focusing on Tier B and Tier C cities, where women can be nurtured to taking on roles either as entrepreneurs or business professionals or even within corporate. So that's the third piece that we work on intently. The fourth piece is what you're going to listen to today. It's about well-being. It's about health. A lot of women fall off the trajectory of their career journey owing to poorly managed health or health-related situations. And it is our endeavor to constantly help women understand their own physical and mental capabilities and make sure that they are physically fit and mentally capable to take on senior roles within their companies, within their corporations. So with that in mind, we have put together this particular webinar, which is on transforming women's healthcare. And I can't but thank MedPiper for really curating this whole event for us. So let's look at this a little bit. While talking about women's health, it is important to consider it beyond sexual and reproductive aspects of it. Very often we kind of constrain and limit ourselves to talking about these. While men and women may have overlapping health challenges and needs, women face greater difficulties in obtaining healthcare due to gender-based inequalities. Women's health has historically been neglected. Various cultural and socioeconomic factors, as well as societal norms, have traditionally prevented women from putting their health first, with the focus chiefly being on their reproductive. Primary and continuous care is needed, starting from childhood, lasting through adolescence, the reproductive years and beyond, to provide women a good quality of life. And therefore, I'm really glad that we have some young people who are listening to us this morning. And I'm sure it will really help you take some very early steps towards managing your physical and mental health. Every woman suffers from gynecological disorder at some point in her life in the form of Pcos, PCOD, pelvic inflammatory disease, chronic pains, endometriosis, and the list goes on and on. In our society, mental health has largely been relegated to the sidelines. Healthcare workers, physicians, therapists, and the general public all need to join forces to banish the taboo surrounding mental illnesses. And we've done enough programs to really give a strong spotlight on mental illnesses. And in my tenure, it is my endeavor to continue being on that journey and continue providing more and more tips towards managing and maintaining a very positive mental health. On the other hand, bone health for women, one of the causes is decreased estrogen after menopause. After menopause, women may lose up to 2 to 5% of their bone mass per year for 5 years. This puts women like me with thin bones at a very high risk. Slow yet steady, our world seems to be headed in the right direction. Corporations, startups, nonprofit organizations, and policymakers are coming up with novel solutions and policy reforms to solve these health issues. And I hope you have a pen and paper today, because what you're going to listen from panelists are an amazing set of tips to help you maintain a positive and well-balanced health. It's my pleasure to introduce three most prominent medical professionals here today. We have with us Dr. S. Usharani. She's a lead consultant and head of obstetrics and gynecology department at Dr. Mehta's hospitals. She's a retired professor of Madras Medical College, a competent professional with over 35 years of enriching experience in OBG and proven clinical and surgical expertise. She has a wide experience of working with doctors in other medical and surgical specialties and has an up-to-date knowledge of new research, treatments, and practices. She joined the Tamil Nadu Government Medical Services in 1989, and that's a rich body of experience, and served in various hospitals across Tamil Nadu. She's also a teacher for over about 20 years, and her areas of expertise are in urogynecology and laparoscopic surgery and infertility treatments. I'm sure you will benefit from what she shares with us today. Joining her is Dr. S. Janani, a consultant psychiatrist who completed her MBBS from Vinayaka Mission, Salem. She has done her psychiatric medicine from Christian Medical College, Vellore. She practices hypnotherapy extensively and is also a visiting lecturer of the National Institute of Empowerment of Women with Multiple Disabilities. She runs her own private establishment called Shraddha, dedicated to treating people with mental ailments in Mandaveli, and also is a visiting consultant at Apollo, Chennai, Meenakshi, Bilroth, GEM multi-speciality hospitals. Her areas of interest include depression, anxiety, teenage problems, and she regularly writes in magazines like Kungumam Kumudam, which is dedicated to mental ailments. Having myself a daughter who's now going to specialize in psychology and clinical psychology, I'm sure the kind of depth of knowledge that Dr. Janani will bring to all of you will be of immense help. Joining both Dr. Usha and Dr. Janani is Dr. Shirin Sarah Lysander, who graduated from the Pondicherry University. After her MD and DNB in anesthesiology, intensive care, and pain medicine, she obtained her fellowship in interventional pain management under the mentorship of Dr. Karthik Natarajan, who is the chairman of the World Institute of Pain. She's currently an intensivist at Apollo Specialty Hospital and a consultant of spine and pain physician at Lysander Pain Care and Orthopedic Center in Chennai. She's an expert in non-operative and minimally invasive interventions as part of her pain management. I can't but thank Soumya for really curating this whole event. Soumya is from MedPiper, and we look forward to MedPiper to be partnering with us at IVIN throughout the whole year. Thank you so much, and I wish you all very good during the session, hoping that you will take back a lot of learnings. With that, I hand it over to Soumya. Thank you so much, Soumya.
Thank you, ma'am. Connecting with IVIN for program for women healthcare and wellness. So I'll just give the flow of the program today. So we'll start with gynecological issues with Dr. Usha ma'am, and we'll go for the second topic on bone health with Dr. Sarah Lysander, and we'll talk about the mental health by Dr. Janani. So that is the flow of the program. So I'm going to share the PPT of Dr. Usha ma'am so that we can start the discussion in terms of gynecological issues faced by women. Okay. Usha ma'am, are you ready? Can you unmute? Ma'am, can you unmute?
Yeah, can you hear me?
Yes, yes. I'm sharing your PPT. Okay, one moment.
Yeah. Can we go ahead? Yeah. Okay. First of all, let me thank the organizers for giving me this opportunity, and Hema for giving such a wonderful introduction about me. Anyway, like today's topic, I have chosen to just highlight certain common doubts which the common people have. That is regarding menstruation and regarding screening procedures like that. So, like commonly, but I haven't touched and PCO and obesity. Such things only I have touched because it is all gynecological problems. It is difficult to cover in this one session. So, what I thought is constantly people come with certain doubts. So, I have focused only on those aspects in today's talk. So, let us proceed. So, first of all, I have a lot of patients. The mothers are so worried when they say that my daughter has not got her periods. See, last month she got it on the 1st. Now today it is already 3rd. She hasn't got her periods. It's already 10 days later and she hasn't got her periods. So these are some queries which the mothers are worried. See, we have to understand what is the normal duration. The frequency can be anywhere between 24 to 38 days is very normal. Again, the bleeding, sometimes they will say my daughter's hardly bleeding. She bleeds only for 1 day, or sometimes they say she has for 5 or 6 days. So again, having a flow for just 1 day or up to 8 days is very much normal. And then the volume again, maximum of about 80 ml and a minimum of about 5 ml is considered as normal. So if we understand that this is normal, I think the mothers will not worry too much about slight irregularities or slight decrease in flow or increase in flow. Such things they can, rest assured. Now, why is it that we have to focus on the menstrual problems of women? Now, menstruation can affect all aspects of a girl's life. For example, if the girl is going to school, she might be worried to go to school during periods because probably she doesn't have a proper facility where she can change, or the teachers may not understand and give her the right, give her time to go and change herself, or she may not have the necessary supplies. So all these things can play on the child's mind, and ultimately it may result in underperformance or they can absent themselves from school. Similarly, the economics, like where women who miss work, if they don't have access to the supplies or facilities they need, again will be contributing to economic loss. Then health. Now, if you if they do not have the proper knowledge of how to handle these issues, particularly children and teenagers, and they do not have access to proper materials proper sanitary pads, proper toilet facilities, and all these things, they can end up with health issues. Again, the girl child should be educated properly of that it is only physiological. There is nothing to feel ashamed of about her periods. And so this will at least help her maintain her dignity. Then again, participation in various events like in school, work, sports, or anything should give her the confidence that she will not leak during her periods, isn't it? So all these things can contribute to the child's psychological development, and she can go in for depression if she's not able to manage these her periods properly. So that is why it's very important to handle these issues and educate the mother as well as the individual. Now, what are the symptoms you need to consult the doctor? So, for example, see, there are 4-5 symptoms which I have mentioned on the screen, like this mood swings, bloating, headache. All these things are likely to happen just before the periods. We call it as premenstrual syndrome. This premenstrual syndrome can be distressing. Sometimes it is it can affect the day-to-day routine as well. So when it is affecting the day-to-day routine of a woman, this premenstrual syndrome also has to be addressed. This bloating generally subsides. Bloating and mood swings and all will subside once the menstruation starts. So if it is really distressing, they need to meet the doctor to get an advice regarding this. And the other symptoms are nausea, cramps, and fatigue, and all. And change bowel habits may change. All these things go with during menstruation. They can have such problems. So any of these problems, if it is really distressing and disturbing and interfering with the routine work, needs a doctor's consultation. Now, coming to see, actually today's program, I would like to focus on the use of menstrual pads and focus on eco-friendly methods of managing the menstruation. So what are all the materials we are using for during menstruation? First is the menstrual pad. This product is worn externally. It can either be disposable or reusable. Reusable ones you can wash and reuse, and disposable, of course. The thing is, you have to change this every 4 to 6 hours, irrespective of whether the entire pad is soaked or not. It has to be changed by 4 to 6 hours. It has to be changed. Now, the next thing is tampons. Tampons are designed in such a way that they are inserted inside the vagina and they absorb the menstrual fluid as well as the vaginal secretions. So they are made up of rayon or cotton, or a blend of rayon and cotton along with synthetic fibers. So the thing is, here in the previous, when we are using the sanitary pads, the menstrual blood gets exposed to the air and it can cause the changes which cause due to oxidation can cause a bad smell. But whereas in this tampons, they do not, this problem of bad smell is not there. So the tampons also have to be changed every 6 to 8 hours. Now, how to use this tampon? See, you can see the thread, the tampon is attached to a thread is attached to the one end of the tampon. So this tampon is introduced into the vagina with the thread lying outside. So once, if one wants to change it, just pull on the thread and the tampon can be changed. So this is very, very convenient. So the next is the menstrual cups. Now, my focus today is going to be on menstrual cups because of the tremendous advantage it has both to the user as well as to the earth, Mother Earth. Ecologically, it is very, very friendly. So I only hope that at least few of you will switch over to this and spread this information to others as well. This is a very important thing which I thought I must share. This menstrual cup is a small, flexible, funnel-shaped cup. You can see it on the picture there, made of rubber or silicone. And this is inserted into the vagina in such a way that the menstrual blood is collected in the cup. Now you can see the picture of the uterus, vagina, cervix and all. And you can see the menstrual cup in place on the picture on the right side. So the blood will be flowing out through the cervix and it will get collected in the menstrual cup. Now, how to insert it? So you have to wash your hands, apply some kind of a lubricant. It can be either water or water-based lubricant to apply to the cup. Then tightly fold the menstrual cup into half, holding it in one hand with the rim facing upwards. Insert the cup with the rim up into the vagina like you would introduce a tampon. It should sit a few inches below your cervix. Once the cup is in the vagina, rotate it. Once you rotate it, it will spring open and it will create an airtight seal that stops the leak. Now this you can see how. See, first wash your hands, then with both your hands you catch hold of the rim and compress it, and then you fold it and hold like that. The third picture shows you how to hold. And in that position, you introduce into the vagina and place it. And then in the last picture, you see if you rotate it, it will sit in position. So that is, I'm sure it's very clear as to how to use this. Then comes how to remove it. Again, you wash your hands, place your index finger and thumb into your vagina, pull the stem of the cup gently until you can reach the base. Pinch the base so that you release the seal and pull down to remove the cup. Once it's out, empty the cup into the sink or the toilet. See, this is how you wash your hands, fold it, inserting in the third picture. The fourth one, fifth one, see the knob like thing, you just hold and you pull it out and then you wash and you can reuse it. Now coming to the comparison between pads, tampons and menstrual cups. See, of the three, which gives you free mobility? Tampons and menstrual cups, you don't have to worry about staining and all that. So you can freely, you won't even feel you're wearing it. So you can easily move around. Whereas pads, you know, the mechanical effect it causes in the local area, then cannot be felt when wearing. Yes, the pad, you will always be constantly feeling that it is there. Whereas the tampon and menstrual cups, you will never feel that it is there at all. You're wearing it at all. Doesn't cause irritation or dryness. See, the menstrual cup never causes any irritation or dryness. Whereas tampons, it absorbs not only the menstrual blood, but it absorbs vaginal secretions also. So that leads to dryness. This pad may be not so okay. No chemicals or perfumes. Pads and menstrual cups do not use any chemicals or perfumes, but tampons do have. Then not linked to toxic shock syndrome. Toxic shock syndrome is something, is a streptococcal infection which happens sometimes when you use a tampon, but it is not common with pads and menstrual cups. Then you can wear for up to 12 hours. Only menstrual cups can be used up to 12 hours. Pads have to be changed every 4 to 6 hours and tampons at least every 6 to 8 hours. Then during sleep, which is most comfortable, the menstrual cup is most comfortable during sleep. Whereas pads and tampons, you can wake up to a wet sheet. So when you look at the overall thing, menstrual cups are the best method of handling periods. During periods, menstrual cups have the best results. Now, why you have to switch over to menstrual cups? First of all, it is very comfortable. You can wear it. You never realize that you're wearing it. It is very, very comfortable. Next, it is very economical because one cup, if you buy, you can use it up to 5 to 10 years. Then imagine the money saved on buying sanitary pads. Third thing is the rash. It is rash free because we know many people are allergic to these sanitary pads. When you continuously use it for say 5, 6 days or 7 days a week, they develop rashes in the perineal region. So you're free of that. Then no leaks because hardly you don't have to feel conscious about whether you will stain your clothes or what kind of clothes to choose for the day. You don't have to worry about all those things. But the most important thing about menstrual cup is it is very, very eco-friendly. It's very eco-friendly. So today everybody is talking about saving the earth. I think we can do our bit by spreading this information and switching over to menstrual cups. Then certain myths about periods. Now, periods blood is not impure blood. Everybody thinks it is impure blood, which is held within, and supposing somebody doesn't get their periods, they come and complain, what will happen if the impure blood is within me? So we have to understand that menstrual blood is not impure blood. Another myth is soft food can make your periods worse. This is a myth. It has nothing to do with periods. Then tampons cannot get, some fear that once when somebody uses tampons, the tampon can get lost within. This can never happen, more so because the string is there and you can always pull it out. Then do not, another myth is not to exercise. They advise you not to exercise during periods, but actually moderate exercise is advised during periods because the happy hormones can elevate the mood of the person. Then the notion that women who stick together tend to have synced cycles is just a myth. So don't have to, it doesn't work that way. Now coming to obesity. Now, this is again a very important issue which particularly parents should understand. Parents should understand about obesity, because the problem of obesity starts right from the intrauterine period, right from the time the baby is in the womb, and then it is born, and then during childhood, and then it goes on till menopause. So this has to be addressed right from the beginning. Now, what are the causes of obesity? Socioeconomic status, because this is again plenty. Nowadays, we have to earn something. If you do something, if you deserve it, you get something extra. But now it's not like that. Before the child can think of it, what I did not get, my child should get. So that is the attitude of parents today. And so they over-provide the children. So that is the one cause of obesity. And again, the environment. Now the environment is such that children have all kinds of entertainment within four walls. They hardly go out. So the environment is more in favor of obesity, less physical activity, and hence obesity. That's the same thing. Physical inactivity and sedentary activity contributes to obesity. Our lifestyle now, dietary trends and habits. Now we are all in for junk food. Now junk food, the market is just flooded with junk food and easy access. Just by just one app you download, and then all the junk food is at your doorstep. You don't even have to walk to the nearest shop to buy. So that is again contributing to obesity. Of course, genetic factors we have no control, so that is fine. But then you can still modify those things by, by exercise and diet and all that. Antenatal factors, that is again very, very important. And then the government of India is doing a very good job by screening diabetes. Diabetes during pregnancy, during the antenatal period, is a very big contributor of obesity of the child in later years. So it is very, very important that we understand the importance of maintaining the blood sugar levels well within normal limits. And again, even when the woman is in the antenatal period, it is better to avoid too much of carbohydrates. The exposure to carbohydrates can influence the effect of the high glucose levels on the hippocampus, the brain, and this can lead to later on Alzheimer's and all those things. So this blood sugar control during antenatal period has immense health issues later on in the baby, like obesity. Girl children can go in for polycystic ovarian disease, early onset diabetes, early onset obesity, and early onset cardiovascular diseases. All these are all these are the diseases which the child is prone to if during the antenatal period the glucose levels are not under control. So these are all, that's about the antenatal factors. Then what can happen because of obesity? Insulin resistance and type 2 diabetes can take over earlier in life. Again, polycystic ovarian disease, I wouldn't say obesity causes polycystic ovarian disease. Polycystic ovarian disease is if a girl has PCOD, she is prone to obesity. That you have to take it that way. Then, of course, I just told you cardiovascular disease and psychological problems because of obesity and obstructive apnea, sleep apnea. These things are the effect of obesity. Now, coming to PCOS. See, now every other person, if you take a scan and then they give you polycystic ovarian disease. Okay, once you see this polycystic disease, polycystic ovaries, there is no reason to panic. But the only thing is you have to understand what it is. Polycystic ovarian disease is nothing but the maturation of the egg doesn't happen normally. So there is some problem with the maturation. So the cycles can be, it can interfere with the normal cycles. It can either be prolonged cycles, decreased flow, or profuse bleeding, whatever. But the cycles will be affected. Then this can lead on to infertility later on. Again, the symptoms they can present with this irregular prolonged periods, and then extra growth of hair in unwanted places. And then there can be hair loss. Then there can be acne, pigmentation, pelvic pain, fatigue, rapid weight gain, And because of this, there can be psychological stress and depression. Now, the market is just loaded with medicines for PCOD. See, please don't get carried away. The only way you can manage your PCOD is exercise, healthy diet, control of your weight. You should reduce your weight and keep your weight. Your BMI should be within the normal range and avoid this putting on weight in the midriff. And good sleep. These are that is food, healthy food, good sleep, exercise, and weight reduction. This is the fundamental principles in the management of PCOD. Don't depend on magic medicines which can reduce your weight. If you keep your weight under control, the polycystic ovaries can even disappear, or even if it is there, the menstrual cycles will be normal. This other symptoms may disappear. Conceiving may become far more easier. So focus on that. Focus on your a healthy lifestyle. That is what is required for the management of PCOS. So mothers, please make sure that your daughters have enough exercise and watch out on what they are eating. The next issue is about white discharge. This is another common complaint which many patients come to us with. The problem is we must understand that the vagina will have normal secretions. See, throughout the cycle, there can be some amount of discharge. The discharge in the mid-cycle will be very voluminous, it will be profuse, and it will be very slimy and very difficult to wash off. This is very much normal. Again, during the premenstrual period, there will be an increased secretion, but this slimy discharge in the mid-cycle will give way to a little thick, slightly curdy discharge, which will increase in the premenstrual phase. So this is very normal. So when do you have to worry about this discharge? When there is intense itching and very bad smell, and the color of the discharge changes to say greenish or something like that. So in that case, or if it is blood stain. So if this happens, then you have to worry about discharge. The vagina will never be dry. It cannot be dry. Just like you have some saliva in the mouth or tears in the eyes to keep it moist, there will be some amount of discharge in the vagina to keep it moist, and self-cleansing mechanism. So then about perimenopause, when to consult a gynec. Now, when the woman has heavy bleeding, or when the bleeding is prolonged, she's passing clots and heavy bleeding, prolonged bleeding, postcoital bleeding. If she has postcoital bleeding, she must meet the doctor immediately. Or the bleeding is affecting her day-to-day life. If these things happen, she has to meet the doctor. The general myth is, oh, the periods are going to stop. That's why it is like this. So people associate perimenopausal abnormal bleeding to menopause. So they have to understand that if it is not normal and if and it's affecting their day-to-day life, they have to meet the doctor. Now, what are the symptoms you can expect? Is change in the periods, characteristic of the periods, hot flushes and night sweats, mood changes, vaginal dryness, sleep problems, weight changes. So when all these are there, you have to seek the help of the doctor. Now coming to Pap smear, cervical cancers. See, I think one of the malignancies which can be prevented, we can boldly say that we can prevent cervical cancer by just screening. Now, this Pap smear is a test which is done in the cervix to pick up. I mean, the cervix undergoes a series of changes before it becomes cancer. The changes will take at least 3 to 10 years for the changes to become, if there is a change, for it to become cancer, it takes about 3 to 10 years. So if we can pick up these changes, the changes which are happening before cancer, you can treat it. That's why we say cervical cancer is preventive. We can prevent cervical cancer. Now, we must understand that the problem of cervical cancer in India is very high. Every 7th minute, one woman dies of cancer cervix. And it is very pathetic because cervical cancer is a preventable condition. So now, Pap smear is one method by which we can identify these changes early enough to prevent cancers. So who are the ones who need these pap smears? Sexually active women, for those who are active for more than 3 years, they have to get it done. It has to be done every 3 years, up to the age of 65. And if it is done co-testing, that is with the HPV virus, if you're co-testing, then it has to be done every 5 years. It's a very simple OP procedure, and this can contribute immensely towards preventing cervical cancers. Then comes the breast cancer screening. Now, everybody should be taught self-examination. All women should be taught. Self-examination should be done by the patient herself, maybe once a month or once in 2 months. They can do the self-examination. Women with high risk should go for an annual mammography or MRI breast. From the age of 30, they should go for annual mammography or MRI. Who are the women who are at high risk? Generally, those who are with a family history, say the mother, sister, aunts, first circle group has a history of breast cancer in the family, then they are the high risk ones. Then women between 40 and 49 years are average risk. The average risk here is because of the age. So that average risk persons, they go for a mammography once a year or once every 2 years. Clinical examination can be done once a year. Self-examination, they can do once in 1 or 2 months. Clinical examination by the doctor can be done once a year. Mammography can be done once a year or once in 2 years. That is for 40 to 49 years. Then women between 50 and 74 years, mammography screening once a year. That is between 50 to 54. And more than 55, mammography once in 2 years. Clinical examination is generally not required because generally it will be easy to detect women in women who are older. Women aged 75 years and above with average risk, they should continue screening with mammography as long as they are healthy and have a life expectancy of 10 years or more. So this is about breast cancer screening. So with this, I'm just, I've come to the end of my slides. If anybody has any queries, they can just ask.
Doctor, we can take the Q&A in the end.
Okay.
Yes.
Yeah, thank you.
Yes, thank you, doctor. It was a great presentation on various gynecological issues where a common women face from the younger age to adult. Thank you, ma'am. Now I would like to invite Dr. Sherin Sarah Reinspander to talk about bone health and chronic pain management in women.
Should I be
can you see my PPT? Can you start, Soumya?
Yes, we can start. Yeah.
Yes. So good morning, everyone. So thank you, JournoMed, for this opportunity, and a belated Women's Day wishes to everybody. So let us help celebrate women and help each other grow. So going on to bone health and chronic bone pain. Yes, of course, it's a vast topic. So I've just covered a few important aspects and very common conditions that at least I come across in my routine practice. Just going on, to talk about bone health a bit, and what are the things which are necessary. Probably very simple things, but they go a long way. So starting with, why is bone health so important, and why are we even having this talk today? So bones are the main framework of our body. So they support our body, they help in mobility, they store the calcium and minerals and everything, and they prevent falls. So bone health is ideal to maintain a healthy life. So going on to how bone health can be maintained. So as you know, bone is definitely high maintenance. So there are a lot of factors which go into making the bones healthy. So your bones constantly, they replace themselves. So I don't want to go too much into the pathophysiology. I'm sure we are all aware of all those things. So normally, how is your bone structure maintained? So as we all know, it is the calcium, it is the vitamin D, and then that is how your bone structure is maintained. And every now and then there is something called osteoblasts and osteoclasts. So you have bone regular, there is bone resorption, and there is bone formation, which is happening simultaneously. So that is how your bone is usually maintained in good health. So coming to how to maintain bone health. So I'm sure that all of us are very well aware of these simple things, but putting it into practice has sort of become very difficult due to our lifestyle and, the fast pace of the world. So the four most important things in maintaining bone health. So one is your diet. So it goes a long way. Like everybody says, a good balanced healthy diet which is rich in calcium and vitamin D and all other minerals is very essential for bone health. We sort of take it lightly these days because of the availability of a number of supplements on the market that we think, okay, so today I've just skipped my milk, so I can just take one calcium. So it is not that way. So I will be coming about it a little later. And then coming to the next most important thing, exercise. So exercise is definitely the most important part of maintaining bone health. So we all think that it is only diet or it is only supplements, and okay, we can get away with just maintaining a sedentary lifestyle and yet thinking that we are healthy enough, our bones are strong. No, it does not work that way. Same way as you build muscle and you do strength training, the same goes for bones. And bones also, you have to keep exercising to make them stronger. And then coming to body weight. So yes, I think Usha ma'am had already spoken a lot about obesity and body weight issues. So body weight, I think, plays a vital role in a lot of diseases these days. So, and obviously the risk of obesity is very high these days. So, and the same goes with bone health as well. So body weight in excess can also affect your bones. I think this is something which everybody always forgets. Then going on to supplements. Yes, you can use supplements to, maintain bone health, but I would say it is just a temporary resort if you cannot do it by the above three. That is the reason I've just listed out supplements in the last, because I'm one person who's not in for supplements. Probably, yes, of course, for a short duration, when the need, the requirement is definitely there and you're not able to do the other three, the first three, then we can go in for supplements. So it's always the diet, exercise, and body weight to maintain your bone health, and then only the supplements. So coming to just a short description of what all I have just listed out before. So eat right. So I think a lot of these days that, as Usha ma'am said, junk food and everything. So we don't realize that how much of vitamins and minerals we are missing out on. So our Indian, proper Indian diet, which is the balanced healthy diet, actually has all the components in a proper composition. So but we resort to different other foods, and it is not doing so well. That is the reason the risk of osteoporosis and everything has gone really high in India currently. So eat something which is very rich in calcium and vitamin D. This is very, very, very essential. So it is not just your not just vegetables and not just just other foods that you need vitamin D, you need vitamin C. So it is, I know a lot of things about vitamin C and vitamin B and all those things, but vitamin D and calcium is more essential as well. So eat right. And then coming to active lifestyle. So this is one thing which everyone needs to remember. Muscles and bones, they become stronger and they stay stronger with regular exercise. So it's not like okay, muscles and bones are strong and you just maintain a sedentary lifestyle and you do not give them any work or anything. So in that way your muscles just get you lose muscle mass, and slowly your bone density also goes down along with it. So to stay stronger and have a healthy bone, you have to exercise on a regular basis at least 3 times a week. Then going to body weight. So yes, as I said before, the more you exercise, the more better will be your muscle and your bone health. So it's not only the muscle mass, which it is also the bone density, which also, you know, relies on regular exercise regimen. So go ahead, just knock off the extra calories, you know, especially for women. I think we are all having a lot of, you know, things on our plate. So we tend to put health at last, or especially, you know, exercise bit in the last. So I think we have to, you know, put that first and prioritize, and then, you know, go to other things, because currently women are the ones who, you know, are facing a lot of issues and a lot of health conditions. So coming on to my last thing, which is the supplements. Yes, of course, these days, you know, especially I think with the whole COVID, the pandemic, it has become like supplements have become like the in thing currently in our country. So I'm sure vitamin C, vitamin D, and calcium, I think people have just started taking them in excess. So let me tell you, supplements in excess are not really a great idea. So I'll be coming on to about that also a little later. So yes, of course, you know, some bit of calcium, some bit of vitamin D for some time, you know, for 2 to 3 months, because, you know, maybe, or you have a very critically low value and you definitely require to replace it now, or you're very symptomatic. In those cases, yes, definitely we need to take supplements, but otherwise we can put it off and, you know, and try the other conservative ways. So yeah, so the next thing, do supplements really do the magic? Are they really good or bad? So if you see, there are a lot of conflicting studies, especially a lot of studies have come out in Europe and US based on these, you know, increase in the number of, I mean, the millions of supplements are sold in a day. So that is the reason, you know, I wanted to include this in my slide. So as I said before, supplements as such, you know, they carry a lot of side effects, which people don't generally realize. Sometimes, you know, I've had patients who come and tell me, oh doctor, I take like, you know, 3 calcium tablets in a day. 3 calcium tablets, like, you know, normally, you know, they have these 500 milligrams. So they end up taking like 1500 milligrams per day, which is not necessary. Your body probably requires around 300 to 500 milligrams per day. Why do you need to take in excess? And that excess calcium is going to, you know, worsen. It is going to cause you, put you at increased risk of renal stones. It can cause it can go deposit in your arteries. There are so many studies which have come out these days saying that excess of calcium is the reason why there is an increase in, you know, increase in renal disease or ureteric calculi these days. I mean, we see a lot of cases these days, rise in, you know, rise in renal calculi. Why? Is because a lot of patients, you know, they're just abusing calcium supplements. And vitamin D, on the other hand, yes, of course, vitamin D even I prescribe, because, you know, a lot of Indians, you know, we are genetically in such a way made that because of the melanin content in our skin, we generally cannot absorb our vitamin D as good. So, and you know, the way it is supposed to be, like we say, we stand in the sun. Just by standing in the sun, you're not going to absorb it. So you have to, like, you know, your body, at least more than 50% of your body parts have to be exposed, and you have to stand at least for 15 to 20 minutes, and that is when the dermal synthesis sets in. So I think it is quite tricky and it is difficult. And so, you know, most of us are, you know, vitamin D deficient. So in that case, maybe once a year, you know, as the regimen goes and everything, you can take it. But calcium and all of these other vitamins in excess is, you know, is not good in the long run. There are definitely a lot of studies which are supporting this these days, that do not overdo supplements. Then, so from going on to, you know, the main topic. So first I've spoken about just a general view of how you can maintain bone health, because even these small things are things that we generally tend to ignore, especially women. So that is the reason I wanted to just, you know, throw light upon those things. So coming to chronic bone pain. So first I would like to start with what are the causes. So as you all know, chronic bone pain can occur in a number of diseases. So not to be alarmed by what I'm going to talk today, but I've just touched upon a few important or the very common, the top 4 common reasons for chronic bone pain, which I come across these days in my practice. So yeah, starting with, yes, fractures, of course, cause you know, fractures in the sense, I'm talking about, you know, stress fractures, you know, which are prolonged, they go undiagnosed, those kind of fractures. Then osteoporosis, perimenopausal or menopausal, as I think Mrs. Hema also, you know, spoke a little about, you know, how menopause affects women, especially their bone health. And then osteoporosis, osteomyelitis, and yeah, the most alarming part, cancer. I'm going to talk very little about it, although I know that cancer is on the rise and it is very prevalent. Probably we'll have another session somewhere else around, about it. Then hyperparathyroidism, Paget's disease, osteogenesis imperfecta, osteomalacia, multiple myeloma, and tumors, as I said before. So going on to these, I've listed out most of the common ones, and among these, which are the most ones which we come across regularly in our practice, that's what I'm going to be talking about. So coming to fractures. So fractures, in the sense, is because of a fall or it can be an osteoporotic fracture. So in this, if you see the stress fractures, the commonest which I come across in my OPD, and the patients which have stress fracture are mostly women. So and also what happens is, an event happens, they have a fall or a small thing, as it is their bone mineral density probably is very low. So I used to think that before this that only older women who are more osteoporotic can have fractures, very common. Yes, that is a proven thing. But apart from that, even younger women, because of this lifestyle where they have low calcium and low vitamin D, and then bone mineral density is very less, they have very soft bones, they tend to have these stress fractures, very common. It goes undiagnosed for a very long time. They keep, sometimes you tell them to do an x-ray, and they're a little worried that and anxious, that so they don't want to do it, and it keeps going on. So they have this chronic bone pain which is there on and off, this dull aching sort of pain. That is a big difference between an acute fracture, which is like a clear cut fracture where two bones are there, there's a line, the whole bone is disrupted. In those cases, the pain is very severe, there is swelling, there is disability, there is restriction of motion. So you go to a hospital and get it treated right away. But stress fractures are very notorious, so people tend to ignore, like, okay, maybe it's not a fracture, maybe it's just a small sprain or something, or because of the trauma I've had some sort of a pain. So this is something which everyone needs to have in mind. So anytime you have you have a fall or anything, and you have a pain which is just nagging, not very severe, but it's just nagging on and off, then you have to keep in mind that there is a possibility of a stress fracture, and probably go ahead and take an x-ray. Yes, the management wise, it is again going to be a rest and just rest and certain anti-inflammatories, and that's all it's going to be. But that particular thing, at least you should know that there is a fracture which is causing the pain. Otherwise, they get very anxious that, okay, there is a pain, they go to multiple doctors, and it's a never ending process. So then coming to osteoporotic fracture, yes, today I'll be talking in detail about osteoporosis, because I think that is the need of the hour right now. We have a lot of patients with chronic bone pain, all of them above the age of 45. Actually, initially it used to be above the age of 55 and 60. Now I see patients with 45, 50 having a very, very low bone mineral density. So I'm going to talk about osteoporotic fractures as well. Yes, osteoporotic fractures, they have the bones break very easily, so it's just like an acute trauma, and they have severe pain and swelling. So coming to osteoporosis basically is nothing but where your bone mineral density decreases. So it is a normal process as such, if you ask me. So along with age, as a process of aging, so there is decreasing bone mass, but that decrease in bone mass is much faster in women compared to men. That is because of, menopause, and because of the hormonal influences that happen. So what happens is, so this is the epidemiology of that. So 1 in 3 women over the age of 50 years, they have osteoporosis, and while compared to men, it is usually 1 in 5 men. Very rarely, actually, even in my practice, very, very rarely, like, if I get 10 patients, 10 women with older women with osteoporosis, it is usually only 1 man with osteoporosis. So you can see the difference in, the incidence of osteoporosis. So definitely women are more prone. So what happens is, they have continuous pains and aches. So it's more like they have pain in different parts of the body, because it's not like only one bone is involved, or only one part you're going to experience pain, because it's a generalized decrease in bone density. So more often we see in the long bones, the lower limbs, the upper limbs, and then the pelvic bone. So they have severe pelvic pain, and over time, it becomes very difficult for them even to mobilize themselves, and they end up becoming bedbound. So it carries a lot of risk. So osteoporosis treated early, and probably we have to just slow down the process. It all is based on slowing down the process rather than trying to stop it. So most often they have pains and aches. Obviously they have trivial trauma, one, because of the weakness of their bones, and as soon as they fall, they get a fracture. So coming to just to differentiate what is primary osteoporosis and what is secondary osteoporosis. So if you see primary osteoporosis, so it is more common in the older age group, as I said. So categorizing it as before, it is beyond 50 years of age. Previous years, we used to, I think probably when I was studying or something, so we used to see patients with osteoporosis above the age of around say 60, 65. Now it has gone, I think now, as I said, from 40, 45, we start having patients, who have very low mineral density, leaving aside the ones who have endocrinological problems because of the parathyroids and all those things causing hypocalcemia, and those reasons are separate. But apart from that, if they do not have any cancer or any other abnormality, the most common age group we see of primary osteoporosis is over like 45, 50 these days. So primarily, as I said, it is because of the estrogen deficiency, which happens in menopause. It can also, some studies do say that it is, also familial, and yes, of course, more women, and it is generally because of the low calcium and vitamin D intake. So yes, definitely you can ask me that, okay, even a man does not take much, but yes, as I said, it is because of the estrogen deficiency and the hormonal imbalances, which also superimpose on the low calcium and vitamin D intake, it worsens it. And along with that, if somebody is more sedentary, as I said, no exercise or anything, so bone density is again less. So coming on to the next, the secondary causes of osteoporosis. So the secondary causes are generally all the malabsorption syndromes, carcinomas, and then, as I said, endocrinological problems, and then hematological problem like multiple myeloma. So I'll be talking a little about multiple myeloma because, again, apart from osteoporosis, multiple myeloma is also on the rise these days. And then other than that, certain drugs, glucocorticoids, the anti-epileptic drugs, they're very notorious. Glucocorticoids is very established. Like, we know that somebody who's on steroids for a very long time is definitely going to have osteoporosis. There are even studies which say, even the small dose of steroids which are present in your inhalers and things can also lead to osteoporosis. And apart from that, your anti-epileptic drugs are also, notorious for these, osteoporosis, secondary osteoporosis. So here I just have a picture of how your normal bone architecture looks and how an osteoporotic bone looks. So if you can see, the whole microarchitecture itself is changed. The mineralization pattern has changed. The bone has more spaces, marrow spaces, because it becomes more porous. Usually a bone which is much denser becomes much porous. And then if you can see an X-ray, it will have a nice thinning, like an outline, like it's because so much of your bone has become porous and things. So the cortex alone appears very bright. So going on to how you prevent osteoporosis. So prevention, as I said, it's only by, just delaying the process and trying not to worsen it. So first thing, all your lifestyle modification, that is your alcohol intake, caffeine intake, everything has been, interlinked with osteoporosis of late. A lot of studies have been conducted in Europe and US, where they have actually said that, alcohol intake, caffeine intake in women, smoking, all of this has a very high impact in reducing bone density and causing osteoporosis. And the next thing is, especially for patients who already have osteoporosis, which is severe. So for them, how to prevent falls, with certain lifestyle changes. Then you use hip protectors, the padding which prevents. So even if you do have a fall, you, as we know, pelvic fractures, neck of femur fractures are all very common in people with osteoporosis. So, binding the pelvis with a nice hip protector can actually help them, especially in older patients. I do suggest them, like, they just wear a protective padding, especially if they're staying alone. And nutrition. Yes, you can increase your calcium intake in the diet, oily fatty fish, and then milk and eggs and all those things. And apart from that, yes, if you are definitely in osteoporotic women, older women, I do give supplements because their oral intake as such is very less. And so in that way, the recommended daily allowance also, they don't even make up to the 500 mark of calcium, or it is usually 100 milligrams or 200 milligrams is what they consume or anything. So in that case, I definitely prescribe some bit of calcium because it does help, in some way. So coming to the treatment options, as I said, so initially it is the pharmacotherapy, then addressing the secondary factors, as I said. So it is a primary causes. So primary cause, you start with, usually I start with lifestyle changes, then slowly going on to pharmacotherapy, and then going on to addressing the second factors. What are other causes are there if there is a notorious steroid intake or a steroid abuse which is happening that is leading to osteoporosis. Probably that is something which I come across very often these days, especially probably the younger group of patients, 30 to 40s, who have this decreased bone density, and then you find out there is some bit of this oral steroid usage is there. And then so we start with calcium supplements and vitamin D supplements as the basic thing. And then we go on to the bisphosphonates. So, these are the anti-resorptive drugs. So as you know, they prevent the resorption. So as I said, there is bone formation, there is bone resorption. So bisphosphonates, they will help prevent the bone resorption in these patients who are osteoporotic, so that there's no further decrease in bone mineral density. Calcitonin and parathormone, yes, it's probably in the much later stages which I use them, so I don't give them in the beginning itself. And hormone replacement therapy is another one which a lot of people have started using now, and it is showing some bit of promising results, yes, of course, with other certain adverse effects. Coming on to calcium, so just a bit on how much is actually required. So these are the recommendations which are said that above 50 years of age, it is usually 1000 milligrams per day of calcium, and over the age of 51 years older in women, and 71 years. So here also you can see, the calcium requirement in women is much more even in the early stages because of, as I said, the menopause and the related hormonal imbalances. So 1200 milligrams per day of calcium. So then usually I would say 800, somewhere close to 500 to 1000 milligrams per day is adequate. Even if you ask me, just 500 to 600 will do good. And then excess, as I said, excess of more than 1200 to 1500, sometimes it goes much beyond. What they do is they take supplements which already have calcium. Apart from that, they also end up taking calcium which is separately. So these all have gone, and there's a high risk of renal stones, cardiovascular diseases, and CVAs and all those things. Recently of late we have been seeing, and in most of the patients, at least like 3 or 4 out of the 10 who come with renal stones will definitely have a history of having excessive calcium intake in the form of supplements. Coming to vitamin D, vitamin D is something, at least now, like off late, people have started creating a lot of awareness about it. Previously, it was very limited, that people knew that there is something like vitamin D can cause so many symptoms, which, are very, it's just you replace it and you just become all right. So, but then, we were not aware before that this is what the vitamin D is about. So vitamin D comes with just a small thing about the symptoms which it causes. So fatigue is something which I come across very commonly. So the normal cutoff is usually 20 for vitamin D. So we have patients coming with 4, 8. Usually in the Indian population, it is around that much only. So they have chronic fatigue. So what they do is they have a lot of body pain and they have bone pain also. Some patients say I have a lot of bone pain apart from joint pain. So in these cases, if you actually check, they will have a vitamin D deficiency, and only by managing that, the pain just goes away. So apart from that, it causes a spectrum of symptoms, but main thing is this chronic fatigue which I have come across. So once you replace it, within 2-3 months they have drastic improvement in the pain. So instead, people start labeling them as actually I've not included fibromyalgia today. That is something I think is a vast topic which cannot be fitted into this particularly. So patients think they have fibromyalgia, they have cancer or something, because of chronic fatigue and the pain that they keep experiencing. Could be just the vitamin D deficiency. So the recommendation is 50,000 units or 60,000 units, which we usually prescribe once a week for 8 weeks, followed by once a month for the next 3 to 6 months as a maintenance dose. So yes, coming to the next, another important condition is osteomalacia. So osteomalacia is, so the difference between osteomalacia and osteoporosis is, in osteoporosis, there is a decrease in bone density. Osteomalacia is more of a bone demineralization. So the bone becomes really soft, and it is usually, so we know that osteomalacia in children is called rickets. So that is something which is recognized, and it has been there, and in our books also design, we keep seeing patients with rickets, we treat them as well. So in in adult population also, there is something called osteomalacia. So their bones become really soft and spongy. You can see in both these x-rays, they see the outline of the bone is there. It is all looking very hyper. But even though it is, it's just looking brighter, but you see the cortex of the bone, it is very thinned out. Apart from that, the bone as such, looks very translucent. So that means the mineralization part is very less. So these kind of patients, usually they have pain, and a very dull aching sort of pain in the back, the ribs or the hips, the long bones. Then the pain is usually very, it is persistently there because the bones are soft, and with every movement they have pain. And the bones generally, and there are also spaces or called the looser zones where the fractures tend to happen very frequently. And these patients also will have symptoms of hypocalcemia, like, symptoms as well as signs, like, they might have ECG changes, or they might have all these other symptoms of hypocalcemia as well. So coming to next thing, which is very common cause of chronic bone pain these days. Yes, patients present to us very sick. So multiple myeloma, as we all know, it's a cancer that begins in the plasma cell. So there is the usual thing is about body's immune system, which is involved in producing antibodies. So these patients have a sharp pain. It is not the dull aching pain in osteomalacia or the osteoporosis or a stress fracture. They are very sharp pains pointing, to the legs. Mostly I've seen they have pain in the legs and the knees and thighs, very rarely, and they have pain in the shoulder usually, so less commonly in the hand and other things. They also have the tendency of bone breakage very easily. They have difficulty in walking, and one symptom probably more differentiating is the muscle cramps and muscle pain, which they have. And coming to hyperparathyroidism, again, as I said, endocrinological diseases have a major role in bone demineralization, bone density, like how we had estrogen. There is also a parrot hormone which acts and also causes bone resorption, and all again leading to, and women again are more prone for hyperparathyroidism. And very rarely, like we just think that hyperparathyroidism might be rare, but that is also again a common cause for chronic pain. So they have fatigue, they have depression, they also have muscle weakness, and they have aches and joint pains almost everywhere. So the very chronically, and hyperparathyroid, we usually don't think about much. Usually everybody's like, okay, there's hypothyroid, and that's all, we leave it. So no, hyperparathyroidism is also an important factor that needs to be looked into if somebody is presenting with chronic bone pain. Then of course, last bit, coming to the cancer pain, it can be either a primary bone carcinoma, or it can be secondary or the metastasis from some other primary source which is causing the pain in the bone. Like you have adenocarcinoma of the lung, or you have some ovarian carcinoma, but there are metastases in the spine. So that can cause severe pain, usually these kind of patients. So when it comes to the intervention point of view, probably have these sympathetic blockades and things. That is what I do. I do a lumbar sympathetic plexus block, to relieve the pain. Apart from that, we give spinal cord stimulators and all that for these kind of cancer pain. So cancer pain again is more, bone pain. It is because of the tumor infiltrating inside which causes the pain, and because there is expansion of the tissue. So there is tenderness as well, most commonly in the long bones. So pretty much most of these chronic bone pains, they involve somehow only the long bones actually, because arthritis and all involves mostly the small joints, and then they go to the bigger joints. Here it is predominantly the bigger bones and the bigger joints which get affected. And coming to, so some symptoms of bone cancer. So we'll know that, this patient definitely needs further evaluation. So that's all about chronic bone pain and bone health. So exercise, eat healthy, and stay healthy. Thank you.
Thank you, Dr. Cheryl. Indeed, it was a great session on various aspects of bone health, and how much vitamin D or calcium that we need to take. Even I am one of the person who takes a number of calcium tablets every day just to compromise the calcium intake that we need to have every day. So thank you so much, doctor. Now I have Dr. Janani. She will be talking about mental health and awareness and various aspects of mental health issues in women. Over to Dr. Janani.
Hi, good afternoon. Thank you so much for having me here today. And really eye-opening topics today. I think it's really benefited everybody here. And a lot of information gathered from both the doctors. I'm hoping to add a little to how mental health can actually really help. Just give me a second. It's struggling a bit. So I'm going to be talking about some of the mental health concerns faced by women. So what exactly do you mean by mental health, and why is mental health important? So there's so much of talk that goes on about physical health in general, and there's I honestly feel that now there's a lot of awareness that's being created about mental health, especially post-pandemic, after the pandemic as such. But why is mental health important? Why do we even have to talk about it? Why do we have to discuss about it? And why in women is it very important is my goal today. Okay? So what is mental health? So according to the WHO definition, it's our emotional, psychological, and our social well-being. So if you look at this, this definition already includes well-being that sounds very holistic. And with my talk, you'll realize that our mental health is extremely closely connected to our physical health. So to a large extent, if our mental well-being isn't good enough, then our physical well-being reciprocates, and hence you may not find that you're physically well either. Right? So it basically determines how we handle stress. It determines how we relate to others and what sort of healthy choices we make when it comes to our life. So like I've been saying, mental health is extremely important. I would say in par with our physical health, and with no offense to the doctors here, I would say sometimes it's even more important than our physical health, because you may be in the peak of your physical health. However, if your mental health isn't in par, or if it isn't balanced, then you would find that, there isn't any motivation to do anything. There isn't an interest to do anything. And it's just really, really difficult, right? So if you look at the statistics of mental health concerns in women in particular, you will find that this is the worldwide statistics, up to 1 in 5 women suffer from some maternal mental health issues like a postpartum depression. You will find that up to 50% of women who live, especially in poverty, suffer from some sort of a mental illness. More than 600,000 of women, especially in the States, have maternal mental health problems as such. Anxiety and depression are on the rise, and I can definitely tell you that post-pandemic, post the onset of COVID, the number of people, especially women and young women, suffering from some mental health issue or the other has risen enormously, right? So every second person is struggling with some form of a mental health issue or the other. So if you look at India, 1 in 20 people in India suffer from depression, right? And if you look at the accounted suicides, you'd find that as opposed to men, the number of suicidal attempts in women is far higher, right? So on the global suicide scale, actually India is way high. Right, and in our country, unfortunately, that the mental health professionals, especially psychiatrists, who actually are in practice as compared to the population that we have, is extremely low. And you would find that only 10% of the people who do suffer from mental illness actually are able to seek help. But again, I'm very thankful to the younger population, because I think with the advent of social media and with the advent of social media spread, there is a lot of awareness that's happening, especially after the pandemic, where youngsters are talking about mental health. A lot of young people are coming out with mental health issues, and there's a lot that's being done to reduce the stigma, which was extremely prevalent and unfortunately is still prevalent even today. However, there is more awareness, right? But again, this is more the urban population that we're looking at. If we look at the rural setup, importance that is given to mental health is still extremely low. So I think it's also important for all of us to try and spread, awareness about how mental health is equally important and which needs to be looked at. So if you look at the gender prevalence, mental health is also clearly gendered, right? So it starts biologically from the way our brains are wired. So if we look at the way women cope with stress and at the way men cope with stress in a very generalized fashion. There are clear differences, and there are also statistics in studies that go to show that women, there is a predilection of women to suffer more from internalizing disorders, which means that women tend to take in more, we tend to repress, we tend to push in more, as opposed to men who suffer more from externalizing disorders, meaning where their emotional issues are coped by, they cope with emotional issues by, sort of pushing the problem outside, right? So, for example, they're more into substance dependence, they're more into violence, they're more into aggression, as opposed to women who suffer more from anxiety and depression. And in India, it's knowledge that we all have that we women tend to have 10 hands are not enough for a woman, isn't it? So because we look after home, we look after our profession for ones who are working. We have to cater to the needs of the people in the family, and we play different roles, sometimes unfortunately at the same time, and more so for the women in the lower socioeconomic status where they are forced to work, isn't it? Due to economic deprivation, they have to look after family, they have to go to work, they need to meet day-to-day expenses. Sometimes in many of the families, the husbands are not working. I know of a lot of families where the husbands are substance dependent, and so, or they're mentally unwell or they're physically handicapped, as a result of which it's the women who have to be the breadwinner. So there is so much that is there on a women's plate all the time. And if you look at, our evolution as such, we are considered to be the more frail of the two, isn't it? So right from when we were hunters and gatherers, we were given the slightly less arduous or physically strainful sort of activities. But in today's world, we may not be, we find women even in construction, isn't it? So I know of a lot of women who are employed in the construction business who actually lift weights. And so you can't, though we are considered the physically weaker of the two, if you look at it, we are the ones who bear children for 9 months. We are the ones who give birth to children. We are the ones who look after the kids. So there's so much there is to a woman, and that's exactly why I think Women's Day needs to be celebrated on a daily basis and not just once a year, where women are actually looked at, because through the year, along with so many households, women are deprived of basic needs, women are abused, women are subjected to domestic, physical, sexual abuse, and women from all ages are constantly in peril, isn't it? So, I mean, you read so much nowadays in the papers about how there's an enormous increase in sexual abuse from newborn kids, right? Newborn girls to women as old as 80 years, which is just absolutely alarming. So somebody was, Ms. Hema was talking about, sexual offenses in the office. So, I mean, there's just so much that's happening around a woman's life, which requires her to be constantly on the go. She needs to be constantly on the lookout. And she showed her so much of responsibility. As a result, there is going to be an equal amount of mental health issues that crop up, isn't it? So if you look at who is generally at a predilection for a mental illness, you'll find that it's always a biopsychosocial approach. So there's a biological component, which is the innate coping style that somebody has. It's the genetic contribution that somebody has, along with the psychosocial approach, where you have environmental stress factors which are in place. For example, you have stressful life events. A woman, there may be a death in the family, you have early childhood trauma, you have physical health conditions that contribute, living arrangements. People are not, women are generally not happy. Some women are not happy post-marriage with the living arrangements, low household income would force them to go out. Then you have your genetic factors where you've already inherited a particular thing. Then you have your lifestyle factors, right? Like, for example, substance abuse, or low quality of sleep, poor diet, either being underweight or overweight. Then there is the resilience that you have innate. So there's the biopsychosocial model, isn't it? So how you, like I said, how you cope, what your resilience is, how perseverant you are, how you look at things, how you view things, your the upbringing that you've had, right? So the factors that are protective as well as the social support that you have. So all this together actually predisposes a person towards mental health. So what are some of the common mental health issues that you see in women? Depression being number one, in closely followed by anxiety. Of course, we women go through a reproductive cycle, so we have mental health issues that come again at all stages. So when the premenstrual syndrome that you have along with, which is very in close sync with your menstrual periods, as you go, then once you have your once you're postpartum, you have postpartum depression, postpartum blues. Then as you go towards your menopause, there are any number of mental health issues that come in and around the menopausal time, right? Apart from this, you have eating disorders in your teenage period. You have girls either with anorexia, you have girls with bulimia. Ma'am was talking about PCOS. So you have a lot of young girls who are overweight. Obesity is on the rise. And so there are a lot of mental health issues that come as a result of your body weight, your body image distortions that take place during that time. And apart from all this, you have your major mental issues like your schizophrenia, your bipolarity, personality disturbances like borderline, which are much more common in women. So I'm going to quickly go through these because I've only given you terminologies. So I'll quickly run through what each of these are so that you have an idea of what I'm talking about. So what is depression? So depression is a term that's very loosely used, and a lot of the times we confuse the core depression as an illness with loosely used I'm feeling depressed, right? So on a day-to-day basis or over the week, up and down, we all have mood swings. We all have mood swings as in moods that go up and down, isn't it? Our moods are not stable through the day or through the week or through the month. So mild ups and downs that still allow you to function, which are in correlation with the stressors that are happening in and around your life, is still fine, right? As long as it's not affecting your biological functions or your ability to function as an individual. But the minute this period of depression or low mood that is the basic, along with a disturbance in your biological setup in terms of your appetite, your sleep, your interest, your functionality at work, general fatigue, general loss of interest, if all this extends for a week or more and it's continuous, either it's continuous or it comes in an episodic pattern, that is when we look at depression as an illness, right? So saying I'm feeling depressed at any one time is not considered to be depression. Please understand the difference, because like I said, depression is a term that's used extremely loosely. So at any point you speak to anybody, they'd say, yeah, I was depressed. So that's still fine. But if this is a continuous pattern, that's when you have to look at it. So in depression as an illness, I've mentioned all the symptoms. There's we call it as anhedonia. There's no interest in doing anything. There's fatigue. They don't sleep, or they sleep too much. They have trouble concentrating. There's no focus. You may have suicidal thoughts. You may not act upon them, but you may still wish that you were not alive. So that's depression. This is very, very closely related to what we term as anxiety. So anxiety in layman's terms is when you're constantly worried and you're on the edge. This is something that I keep telling a lot of people I meet. All of us are evolutionarily born or raised to be anxious, right? So anxiety is a part and parcel of all of us, right? Irrespective of whether you're young, old, male, female, it doesn't matter. But the same anxiety, when it goes beyond a particular level where it's actually counterproductive and it doesn't allow you to function, that's when it becomes a disorder. So worrying about something or worrying which instills a sense of being of planning for something, being prepared for something, is actually productive. Because if you don't have some amount of anxiety within you, you're never going to actually motivate yourself to get anything done. So for example, let's say you have to get to work at 8 tomorrow in the morning. If you're not a little anxious about it, you don't actually plan for the next day, isn't it? So you take life a little too easy. If you're not worried about meeting deadlines, you may actually never get your work done. So a little bit of anxiety is helpful, but at the same time, when it crosses the limit where you're anxious all the time, meaning you're worried all the time, sometimes about things that you don't really know you're not really sure about what you're worrying about. It may be 10 years down the line, it may be 20 years down the line, it may be something that has happened in the past, but you're constantly on the edge. You're restless, you're not able to stay calm, you have a lot of negative thoughts. And like I said, the mind and body are connected. So the minute you have continuous thoughts such as these in your mind, your body is going to react to your mind, isn't it? So you're going to have elevated blood pressure, you can have elevated sugar levels, you're going to have cholesterol, you can have heart attacks. So a lot of your physical changes, I'm sure when you've been to the doctor, or somebody known to you has been to the doctor, sometimes the diagnosis is just stress, right? So stress in layman's terms or in medical terms is anxiety when you're worried about something in particular. Right, so a quick look at bipolar disorder. So this is again a term that I hear very loosely used by a lot of people, and I don't think there's a co-understanding of what bipolarity is. So if somebody has a lot of mood symptoms, and if somebody has a lot of mood swings, they're immediately diagnosed as bipolar. But bipolar is a major mental illness, and it needs to be very carefully looked at. So bipolar, so two poles, right? So on one hand, the person suffers from a depression as an illness which goes on for some time, along with or repeated episodes of what we call as mania or hypomania, where it is just the opposite of depression. So there's either extreme irritability or extreme happiness for no reason. So they're ecstatic for no reason, combined with a lot of physical symptoms, where they are very restless, what we call a psychomotor agitation. So they are psychically, as in inward, and physically, motorically, they're very restless. And there's a lot of disinhibition, there is no judgment. So that in a sense is bipolar. So in a year, you can have these episodes coming back and forth. And then you have a personality disorder, which is very similar to the bipolar in terms of the symptoms. But again, when we talk about a personality, see, again, these are terms that are very confused. So for all of us have a personality. We have an innate way of relating to things in the world and to people in the world, right? So again, this becomes a disorder only when it affects our functioning, isn't it? So in borderline, we call the borderline because at any time they can move from being absolutely well to sudden episodes of intense emotional changes. They can become extremely aggressive, agitated just within a few minutes. They have a very unstable pattern of relating to people, but this is like a pervasive pattern of which you see in them from a very young age. So when we talk about personality as such, a disorder as such, we're looking at years and years of instability. So why is this important? Because borderline to a very large extent is diagnosed in women, and in my minimal clinical experience, I've seen a lot of young women nowadays coming in, fitting into this category with a lot of self-harm, suicidal ideas, multiple relationships that don't last for long, meaningless, very superficial relationships, leading to a lot of heartbreak, thanks to all the social media pleasure that's happening at this stage. So there's enough and more of Instagram and Facebook and whatnot, Twitters, etc., which kind of distorting children's perceptions of life as such. So there's a lot of body dysmorphic features which are coming in as a result of this. I'm not as thin as she is. I'm not as good looking as she is. So on social media, what's posted on Instagram is the epitome of beauty that comes out in all of us, isn't it? So the snaps that are put up on Instagram are taken in such a way that the person looks perfect. And when you see them in person, actually, they look really different. And this, I'm talking again out of experience. I've seen accounts of young kids who look so picture perfect in their Instagram profiles, and then when you see them in person, you see such a difference. So there are a lot of young children or young adults nowadays who have built a sort of life that's almost imaginary, that kind of dwells upon their Instagram profile. It dwells upon how many likes that they get from whatever they post. So it's such a, I would say, a very superficial view of life. You don't really get what life in a sense is all about. So there's a lot of anxiety that comes along with trying to keep abreast of what's happening in other people's life, trying to stay good enough or look good enough to be able to put up snaps on Instagram and stuff. So life is really fast moving. Post the pandemic, children have been at home. young girls, young boys as well. But since we're talking about women, a lot of young girls have been given phones, laptops, thanks to online education. And I get calls from parents day in and day out talking about mood disruptions, mood dysregulations, a lot of negativity, self-harm, a lot of unstable behavior in young women post this. I even had a call this morning about a mother giving me the same history, saying we had to give her a mobile and a laptop for her online education, and now she is locked up inside the room. We don't know who she's talking to. She takes hours to come out of the bathroom. We don't know what she's doing there. She's crying all the time. She takes a razor and cuts her hand. We don't know what's happening. Can you please help us? So this is the sort of rise that we're seeing now in terms of the mental health issues, especially in the youngsters. Okay? Right. So just a quick look at postpartum depression. Ma'am was talking about changes, hormonal changes that tend to happen post-delivery. So we also have to understand that in a woman, there are a lot of hormonal changes that happen post-delivery, right? So most women look forward to, conceiving, they look forward to having a child, but some of them tend to go into a proper depression that tends to happen postpartum. Again, this has to be differentiated from the postpartum blues that somebody has, where they have a 1 week or a 2 week of feeling low and not being able to function, or feeling helpless and hopeless. There's even a question that I saw in the chat box where somebody was asking, how do you help yourself if you've been diagnosed with postpartum depression, which I would get to in the Q&A session. So basically in postpartum depression, there is an intense sense of hopelessness, crying, withdrawal, there's sleep disturbance, there's physical aches and pains, there's an inability or a despondency that a person has, and they may not even be able to look after the newborn child, right? So this is postpartum depression. Again, since we're looking at the menstrual phase, PMS is again something that is really on the rise. I see a lot of young girls who come and tell me, I have PMS. So the diagnosis is already made, makes my life a lot easier. But generally, the hormonal changes are very much in tandem with the mental changes that take place. So PMS is not just before your periods, it's 14 days or like half a month. It's in the luteal phase of your menstrual periods, where they are extremely irritable. There's loss of interest, there's sadness, there's guilt, there's coping with eating a lot, there's a lot of irritability that tends to happen, which again, you can sort of help a lot of young women with. Eating disorders, this is something I mentioned and has rapidly risen after the pandemic. Thanks to all the kids being locked up. Ma'am mentioned junk food, an app that you press and then all the junk food in the world is at their doorstep, which I completely agree with. So I'm seeing young women with anorexia and bulimia on one side, where they don't eat. There's a potential fear of gaining weight. They eat and then there is intense guilt about it, and then they try and they try and purge what they've eaten, either by putting their finger, by retching, by vomiting, by taking, laxatives, etc. And then on the other spectrum, like I told you, is about obesity, where children eat and eat and eat, and there's emotional coping through eating, isn't it? So where you eat to cope with your sadness or your mood or your stress, etc. So this pandemic has been extremely stressful, and I should say that after the COVID pandemic, we need to really look into the mental health pandemic that has come along with it, right? So we also have to look at the social consequences in case of women, right? So there's like, we have gender inequality when it comes to work. We have issues in families because there's a lot of abandonment when it comes to women. There's homelessness, especially for women with mental health issues. I know of a lot of families who tend to abandon them or to push them away. They're ostracized in the society because there's a tag. There isn't enough social support in our country even today. When you have to talk about women with mental illnesses secondary to a lot of physical illnesses, let's say like HIV or Parkinson's or stroke. So mental health issues are not something that you see as an isolated factor. They don't just come when there is nothing else that's present in the environment. Normally, it is secondary, or in a large case, it's secondary to some sort of a medical illness or a psychosocial issue, like I said. And there is still a lot of stigma that is very much present that we need to look into. So now that we have a bird's eye view of what is actually there, what do we do about it, right? It starts initially with looking after ourselves. So the first step is to recognize that mental health is equally important or is extremely important, and it's something that we need to spend time on a daily basis so that we are not put into these disorders in the first place, isn't it? So to do that, it talks about starting. So these are all very basic things that I'm talking about, things that we already know, which have been emphasized over time in all our lives, but we kind of tend to overlook it. We call it grandma's advice and we let it go. But I think it's good to look at our day-to-day life, starting with whether we have a structure in our life, whether we have a routine. So routine would include sleeping on time, waking up on time, including exercise, having a balanced diet. So these are all things that you would see in any magazine and you would think, okay, anybody can give me this advice. I already know what this is. But each of this actually has so much of statistical evidence to it. So why do we have to sleep on time, wake up on time? Why do we have to exercise? So exercise releases endorphins in the brain. So endorphins are closely related to how we feel, right? Eating properly makes a huge difference because what we eat also affects the neurotransmitters in our brain. Taking care of our emotional needs are very important. Prioritizing our emotional needs, especially as women, especially in India, where, like I said, you play multiple roles. Generally, the emotional need of a woman is put as least priority. Emotional needs of everybody else in the family is taken care of by the woman. But what she actually feels or what she actually needs is generally not looked at. And over time, it's been that way, isn't it? See, if you talk to your grandmoms and your aunts and your mums, you would realize that for years and years, they would have pushed how they feel and what they feel about a lot of things inside. They're not allowed to express, especially in our country, in our society. Expression of an emotional need is not considered. It's considered as a source of disrespect, isn't it? So if a woman voices that she's upset about something that's happening at home, it's considered as a disrespect to the men or to the elders in the family. As youngsters, we are taught to not open our mouth. We're not allowed to talk back. It's not about talking back. We're not allowed to express how we feel. We're not allowed to ask questions. So we are raised that way. That society has sort of come to that. Now I know things are changing, but still our society is still very much patriarchal. So if you look at our society, especially in the rural setup, women are still very, very suppressed. So you need to take care of your basic emotional and physical needs. It's important to be connected socially. Again, there is a fine line between being connected and being absolutely obsessive about it, isn't it? So it's important to be able to take a step back and assess situations and emotions objectively, because as women, we are engineered to think emotionally, right? Our emotions play an extremely large role in the way we process things. That's the difference between men and women. So it's important to be able to actually disconnect from your emotions once in a while and to assess situations so that we're not affected by them as much. So many a times women come to me and say, I'm so affected by everything that's happening around me. I feel like I'm very sensitive. Anything that anybody says ticks me off. Why am I like this, right? So this is not a question. This is a question that's actually very common. And I think 90% of the women have this issue where anything in their environment triggers them. So I think the trick is to learn to be not triggered by what people say, by what happens in the environment. Right? So to do that, breathing. When I say yoga, I mean yoga as well as any form of exercise is important. Like I said, healthy eating. Sometimes just journaling our thoughts help because like I said, as a woman, we tend to have a lot of thought and opinions about a lot of things which we are not allowed to express. So when we are not allowed to say it out in the open, just writing it down actually gives us a channel to vent. It's like a channel of safe venting where you're not judged, where your thoughts don't have reactions and repercussions, because you have to constantly worry about what others or how others would react to when you actually speak out loud, right? So here I've written about, the guy talks about Netflix and chill, but again, it depends on what you're looking at, right? So if you're somebody who prefers to go down the spiritual path, I would say please do that. If you're somebody who would still like to binge watch once in a while, I think it's fine. Comfort yourself. I mean, look at your physical comforts once in a while. Take a chill pill. Take a day off. Take a few hours off if possible. I know it's impossible to do it for days together, but maybe an hour a day. Keep for yourself. Read a book that you've always been wanting to read. Take up a hobby that you've always wanted to. Do not deprioritize yourself. I mean, you've done that all along, so I think it's time to also prioritize yourself with the fear that you're not breaking rules or with the fear that you're not taking care of other people's needs, right? Basic relaxation exercises. How do you respond and not react? Count to 10 before you speak. Take a few deep breaths to calm yourself down. Take a quick meditation. Do a quick power walk. Do a quick prayer. Break down problems into smaller parts so that it doesn't look as intimidating. Turn on some relaxing music. Like I said, take a break with the dog. Go take a nice bath. Soak yourself in some warm water. Once in a while, comfort yourself. Buy some new clothes. I know, whatever helps, right? Whatever gives you that joy. But make sure you do this on a regular basis so that your body and your mind also de-stress. Right? So in terms of periods where it's extremely stressful, the 5, 4, 3, 2, 1 coping technique really helps, where it gives you time to sort of calm down and respond and not react to the situation, which entails acknowledge 5 things that you can see around you. So this is like a purposeful distraction from the stressful situation that you're in. Acknowledge 4 things that you can actually touch. Acknowledge 3 things that you can actually hear. Acknowledge 2 things that you can actually smell, and acknowledge 1 thing that you can actually taste. So when you do this, you're purposely shifting your mind away from the stressful situation and allowing your body and mind to calm down so that you don't do anything that you would regret later on. In the end, I thought I would say a big thank you to all the women who I know are making so many families are afloat only because of the women. And I truly believe we women are heroes in our own sense for the amount of the number of roles and the amount of work that we do. So this is to celebrate every woman in our lives, in our society on a day-to-day basis, and to say a huge thanks to all of them. And I think I'll sign off by saying, smile, because a smile can get you through anything. And life is a journey. So as long as you enjoy the process, I don't think the destination is as important. Thank you.
Thank you, Dr. Janani. Indeed, that is a great presentation where you spoke about mental health.
Soumya, we can't hear you. Just adjust me.
Yes, doctor?
Sorry, go ahead. I can hear you. Sorry.
No worries. So thank you so much for touching upon various mental health aspects in women, and you spoke about the journey of women, the wellness, all those things. And I really love the factor that 5, 4, 3, 2, 1 aspects that you have added. I think it's going to be a very good takeaway for all the attendees today. And we have a couple of questions which I will read out one by one, and you can answer accordingly. Dr. Sherin, can I start the Q&A session? Ms. Hemamani? Sorry, Ms. Hemamani? Ma'am, can we start the Q&A session?
Soumya, you can, please.
Yes, sure. So the first question is a proper way to relieve from PCOS, whether it can be cured permanently.
Sorry, please, can you come again, because I couldn't hear all this while. I've just
No worry, doctor. The first question is a proper way to relieve from PCOS, whether it can be cured permanently.
See, you have to understand that a child is born with PCOS. Okay, the genetic makeup is such that the baby is born with that problem. Now, don't consider it as a problem. It's just a variant. That's all. It can be managed. Never think of curing the PCOS. You can, if it is a disease, you can cure it. But it is not a disease. Don't be obsessed that PCOS is a disease. It is only a variation of the, you just have to think that it is a variant from the normal. That's all. It is not a disease. So what you have to do, I already clearly told you, managing your lifestyle. That is the best way to, manage PCOS. Lifestyle management is the treatment. Weight, particularly, they should concentrate on not putting on weight. So, which means, the chain of events which go along with it. Diet, exercise, avoiding junk food, sleep at the right time. Nowadays, this now all of us are information technology has grown so much, and people are all working in shifts. So those who are working in night shifts will be more prone for the problem, because sleep should be at least for 8 hours, and that sleep should be in the natural. I mean, they should follow the natural circadian rhythm. Like they should sleep between say 9:30 till 5 or something. No point saying that I'm sleeping at 12 and getting up at 8 o'clock, so I'm having 8 hours of sleep. So that is also not correct. So very strict lifestyle management is what is required. There's no question. I mean, you cannot cure it because it is not a disease. See, if you maintain a proper lifestyle, a proper weight, and you follow all the yoga, exercise, and all these things, the child will get her periods regularly. She will not need any assistance for conceiving. All her life will be normal. Only thing is you have to pay attention to lifestyle. That's all. But understand it's not a disease, so don't get worried about it. But pay attention to it. That's all.
Thank you, doctor. The next question is, how do you overcome postpartum depression? I think Usha ma'am and Dr. Janani have covered the topic, but again, from you, like 2 points, maybe that can be added value for the participants who are listening, from Dr. Janani and Dr. Usha. Yes.
Ma'am, would you like to go first?
From my part, like it is just that it is a new phase in life. See, once you give birth to a baby, it's a new phase in life. It's a new responsibility. And how well you have been preparing yourself for this motherhood, we don't know. So all this can add to the stress. So only one thing I would like to say is prepare yourself mentally during the antenatal period itself, and maybe you can face your postpartum period better. Another thing is family support. Nowadays, like we are nuclear families, and we want to be alone and things like that. But during the postpartum period, definitely family support goes a very long way in tiding over postpartum depression. I hand it over to Janani.
Ma'am, I think as kind of mentioned the key points, I think social support really helps because there is a general tendency to feel overwhelmed by the sudden responsibility of looking after a young one and yourself. There's a sudden change of sleep-wake cycle that happens if the infant doesn't sleep. So there are so many changes that are happening on a physical basis, on an emotional basis, like I said. So I think it's about preparing for the postpartum period as such. For women who are not prepared, it's an unplanned pregnancy, it happens all of a sudden. I think it's about embracing the change. It's about being connected. It's about voicing, your need for support at that point in time. There's no harm in, we all want to be super moms and super women all the time, but there's no harm in, I think, saying I'm not able to manage, I need some help. Right? It's very hard for many women to reach out and say I need help, because it's like, oh, am I being a bad mother when I say I need help and I can't take care of my infant? So, I know that for one, I had the same difficulty, but I had enough family support to kind of help me through the process. So I think a lot of women tend to overthink, overanalyze small things and make it a big issue. So I think it's about understanding that it takes time to get used to the entire change, isn't it? All of a sudden, you have another individual with you with its own needs that you also have to look at. So it's not easy. It's not like any other change that happens in your body. It's also it's about a different soul that's with you. So I think it's about embracing and just going through each day as it comes and not overthinking it.
Thank you, doctors. The next question is for the gynec. I would like to ask gynec. Recently, my doctor said my estrogen levels are low, maybe because of premenopause. Is it so? If so, how can we help it?
See, premenopause, it is expected that your estrogens will come down. That is a physiological process. Okay. So you cannot expect to maintain your estrogen levels, as it was during the reproductive period. It is bound to happen. Ovarian function is bound to, cease at one point of time. And the body has to cope with this. Now, actually, from my personal experience, there is, you don't require that much of estrogens to maintain, other than the reproductive function, you need estrogens for bone health and for the well-being of the heart and probably well-being of the brain and all these things you need. But then the quantity of estrogens required is far less. You don't require that much. So in this question about hormone replacement and all that, it hasn't been proved. Sometimes they come out saying that you have to replace. Then they come out with the studies saying that it is not required. So there is a controversy going about hormone replacement therapy. So what I would advise is just age gracefully, accept menopause. That's all. And again, good exercise, diet, and all these things. See, subcutaneous fat also can produce estrogen. So whatever is required for the body at that point of time is available. So you don't have to worry too much. Don't read too much. Don't get into things which you don't understand. Just don't go into those things. How many of us know, Indians, we are not at all prone for osteoporosis and all that. Nowadays, we are talking about it because marketing. It's a marketing strategy of drugs. India is a very big market. So they want to market all their products. So they are coming in, dumping ideas into our minds. See, we have enough sunlight. The obsession about the skin tone, skin color, that has prevented us from exposing ourselves to sunlight. If we expose ourselves adequately to sunlight, I don't think you have to worry about this decreased quantity of estrogen and all those things. See, whatever is required is being synthesized by the fat. So that's enough for that period. So don't worry about it. Just lead a healthy lifestyle. That's it.
Yes. Thank you, doctor. What a coincidence. The next question was on osteoporosis in women and how we need to tackle. Dr. Sherin, would you like to add your inputs, like how we can tackle this issue?
Yeah, as I think it's just so much hype about osteoporosis and the supplements. That is the thing. Everybody thinks, I should just take supplements and I'm going to be fine, and they're all inside the house. They don't go out at all. It's like, and the whole thing about color, as ma'am said, no, I get tanned. I tell them, please go and stand in the sunlight in the morning at 7 o'clock for half an hour. They're like, doctor, half an hour, I'm going to get tanned. I'm not going to do that. There's so much this thing. No, you give me tablets, I will take it for life, but I don't want to, get a tan. So this is one problem that we are facing now. When I don't write vitamin D, they just look at me like, why is she not writing? It's supposed to be very good. And that is the thing. I come across this very often now. She's not writing vitamin D. She's not giving me calcium. They're so hyper about it. But I think it's, it takes a bit of convincing and awareness. I think the more awareness people get about, these supplements, then they'll start resorting to the natural ways and healthy ways. I think the older generation, my grandmother and all is pretty much up and about. She's like 8 work by herself, and she doesn't take any supplements. I think that says it all. We just need to eat healthy and go by the balanced diet and sun exposure. I think the tan is worth whatever vitamin D we are getting, so might as well just go and stand in the sun. I write in my prescription, stand in the sun for like 20 minutes every day in the morning. I think just to emphasize on it, that is the thing. So yeah.
Okay.
Yes.
The next question is how to handle anxiety at the workplace. Dr. Janini, would you like to answer?
See, anxiety, I think, yes, workplace is an area where there's enough and more anxiety, but I think it also has to do with handling anxiety on a very holistic basis. See, it's not that I have anxiety at work, I have no anxiety at home. It doesn't work that way. If you're anxious throughout, and you're going to get anxious about everything. So if it's not work, it will be something else. So some of the techniques that I keep telling my patients is learn to breathe properly. A lot of our issues settle when we actually breathe right, and 99% of us breathe wrong, right? We all have a very diaphragmatic sort of breathing. It needs to move back into our abdominal breathing, which is deep, which is slow, right? And And to be able to be less anxious about anything in life has a lot to do with how we perceive everything around us, how we look at situations that are thrown at us. So either you look at something as a glass which is half empty, or you look at it as a glass that's half full, basically. So I know it's very simple when I say it that way, but if you actually sit back and look at the way you look at every situation or every person that you meet, you find that you have an innate tendency to either view things as extremely negative or extremely positive. So the gray area where you're still able to assess people and situations as being neutral and moving accordingly is kind of almost gone, right? So people struggle. There is so much of interrelationship issues that are happening because people, I feel, complicate life. They overthink, they over Google, and Googling is, I don't know, it's just crazy. So I know I'm talking on a very holistic basis, but what I'm trying to say is eat right, sleep right. Definitely do some pranayama on a daily basis. Make sure we de-stress on a regular basis so that you are stress-free at work. Write down your thoughts if you think it's overwhelming, you can't talk to anybody. Try and break up problems into smaller problems. Try and, if let's say you have a boss who's difficult. So the first step is to sit back and look at why he's difficult. Is it because he's difficult as a person? Is he like that with everybody else? Is he like that with you? So is it something to do with the way you work with him? So is there something that you can change within yourself? We're all so quick to jump in wanting to change others and the environment. We fail to realize that half the change has to begin here, isn't it? You cannot change 10 million people you work with, but you can choose to change yourself or how you respond to the situation. So stop reacting, choose to respond. But when you have to do that, see, we have enough of intellect and coping strategies within us to actually do it. But to do that, you need to be calm. So to be calm, whether it's in the home environment or whether it's in the office environment, you need to start breathing properly. So I would say breathe properly, because it's side effect free. It's not money consuming. It's not, you don't need to be on pills. You don't have to see a shrink. You don't have to see a psychologist. But if you can breathe well and kind of maintain your life well, and many of your physical problems will also come down. Your BP and sugar, your cholesterol, your thyroid, your menstrual difficulties, your irregularities, all that actually comes down to a large extent.
Thank you, doctor. The next question is frequent urination issues. Dr. Usha, would you like to answer this question?
Frequent urination.
Yes.
See, the first thing is whether they are taking what is the quantity of water they are taking. Sometimes, you should drink a lot of water. This is what the advice is given. That this lot of water means, I don't know how many liters. So they'll be obsessed and they keep drinking. If you drink too much of water, then you have to pass urine frequently. So if that is not there, then you have to rule out other conditions. If you're not obsessed about drinking too much of water, if that is not there, then what next? What next can be either a urinary infection or an undiagnosed diabetes mellitus or uncontrolled diabetes. These are the common things. So you have to, moreover, that's frequent urination may be a problem in the perimenopause and postmenopausal women, where they have that urge to pass urine frequently. This may be related to an irritable bladder syndrome. Okay, where they will need to have, it has to be worked out. I mean, you have to work up the patient and see what exactly is the problem. But otherwise, generally, I would like to know the age. See, the younger age group, it is usually because of obsession of drinking too much of water. When it comes to perimenopause, usually it is age related, and it can be a problem of overactive bladder, where you have to do some tests and then analyze what it is.
Okay, doctor, thank you. The next question is, continuous back pain, is it okay to have painkillers? Dr. Sherin, would you like to address?
Yeah, So this is one thing I've come across. I mean, lot of drug abuse happening these days, especially among women. Even my friends do that. I mean, like, because of chronic back pain can be because of a lot of issues. But one thing which I've commonly found out is because their back muscles, like there's no strengthening happening there, nothing. So, it's all, fatigue and sedentary lifestyle related. That's what I would say. So chronic back pain, if you really have an issue, probably you might be having a discharge, which we see very commonly. Some are very asymptomatic, some are symptomatic. So we have to based on that, or it can be some other health condition which is causing the back pain, or women in different, either it's an older woman, or because of you're working from home and not sitting properly in a proper position and all that. So back pain can have multiple reasons. So I'm not sure as to why they are taking chronic medication. So either get your, if there's definitely something organic, get it sorted and get it diagnosed and get it treated. Otherwise, just exercise and strengthen your back muscles, and that's the way to go about it. And don't take medications on the long run. All of the painkillers have a lot of side effects which we probably don't realize in the early stages, and but later on, a lot of issues which happen because of painkillers. Because we'll just avoid taking all of these things, try conservative measures, work up, then go ahead, get the cause sorted. What is the cause? Is it a disc bulge or some other pathology or something is there? Then get it treated. Yeah, that would be the best way to approach it rather than just abusing medications, over the counter. Yeah, I hope I've answered that.
Yes, thank you. And the last question is it okay to use naproxen 500 for migraine, which occurs for me every 5 days?
You cannot abuse naproxen. It is definitely not good. I think migraine, I would say, first thing is, yeah, conservative. You have to find out what triggers your migraine. So you have to just find out that and avoid. I'm a patient who suffers from chronic migraine. I've been taking medications and everything. Now I'm off everything. You won't believe. Like, I'm literally off all medications. So basically, it's just you find out your triggers. So, avoid those triggers. Those idiopathic, but, you just have to find it out. Avoid your triggers. Then if it's still not working, then I would, say that you can probably have a short course of, a 2 to 3 months of a proper, the therapy, prophylactic therapy. And then after that, you get a long-term control. That's how I go on about treating migraines in my patients, actually. So initially, it's only consultative for me, pretty much most of the things. I find out the triggers, I tell them to treat it. If it still doesn't work, and then it is okay. Naproxen, definitely not a great idea, especially once in 5 days. On the long run, it is going to be very bad. It's going to cause a renal injury. It is not a very good drug as such. I don't even give it, actually. I don't even prescribe naproxen anymore. Yeah.
We have taken up, okay, one more question is there. Any alternate drug for naproxen?
I don't think I can prescribe anything right now in a webinar. So yeah, probably I'll see you later. So yes, I don't think so. I just try paracetamol. I mean, that's the easy way out. And a lot of patients actually settle even with that. I'm quite surprised, Then sometimes I feel probably it's not migraine even. And I think best is only the finding the trigger and, going on about it. If you still have a headache, try other ways. Try having a coffee, do something which you like. Probably, distraction works a long way in migraine. That's what I found out, actually. So just, better not to take any drugs. That's what I would say. All of the, especially these over the counter, high dose painkillers are not a good idea.
Okay, thank you, doctor. I think we have taken up almost all the questions that has been asked to us during the session, and which was asked in advance as well. And Ms. Hema, can we wind up the session? Prashanti, can you wind up? Okay, so I think we can wind up this session today. And on behalf of MedPiper Technologies, JournoMed, and Indian Women, I would like to thank all the speakers who have joined me today in discussing various, women's health aspects from gynecological issues, mental health, bone health, and so on. And we'll be back with another set of health issues returning to women in next month. And for the attendees, thank you for joining us today, and we'll see you for the next session. Thank you so much. Have a nice weekend. Bye.
Thank you.